before, but the concerns are pertinent to federal law, which has driven insurers away from New Jersey and raised premiums for the few insurers that remain in the state. How do you plan to fix that?
I'm sorry, can you say it again?
Sure. Healthcare. It's been raised this evening.
Right.
But the concerns raised are pertinent to federal law, which has driven insurers away from New Jersey and raised premiums for the few insurers that remain in the state. How do you plan to fix that?
There's actually good news on this front if you live in New Jersey, because our state legislature made some moves that have actually nearly solved this issue. First of all, our state legislature passed a mandate that requires everyone to have health insurance. It's the only way that the math works with the Affordable Care Act. Everyone has to have health insurance. That's what makes it affordable. And in addition, they passed a reinsurance program, and that helps the insurance companies pay for the patients who are unexpectedly expensive. Those two things have stabilized the market here in New Jersey, the marketplace. And in fact, we have insurers coming into New Jersey. And then for this past fiscal year, our rates for those who take part in the exchange have gone down 9%. And I heard on the news over the past couple of days, federally, the same thing is about to happen. That I think rates are going to go down 2% federally, nationwide, for people who take part in the exchange. So the good news is we've actually solved that issue here in New Jersey. So we're on our way to making steps in the right direction, and obviously I support that.
Okay, thank you. Darcey?
I agree with Lisa.
Tony?
As a cancer survivor, no one understands how affordable health care that's accessible to our residents, how important that is. So it's important that we get it right. And there's a couple of things that we could do here in the state to make it better. One is we could allow insurance companies to sell insurance over state lines. We could change some of the mandates and give people an option. Because when you're a younger resident, you don't need all of the mandates. Right now, the way the law is written, if you're a man and you buy health insurance, the insurance company has to provide for certain testing that only applies to women. It makes no sense. It makes no sense the way the law is written. So we need to go back and we need to change it. We need to make it more competitive to allow for lower premiums. And we need to allow it to be sold over state lines. And we need to pass the legislation that I have that would prevent insurance companies from interfering with the doctor's orders for his patient. Right now, we see insurance companies deny. That's their initial response to any claim you make. It's denied. You're given a prescription, a test, or a procedure, denied. And then you have to fight for it. The legislation that I propose would prohibit insurance companies from issuing that denial routine.
Darcey, you'd like to respond to that statement?
Well, does Brad go first? Yes, it goes first.
Can you just repeat the question?
Sure. Healthcare has been raised a lot tonight, but the concerns raised are pertinent to federal law, which has driven insurers away from New Jersey and raised premiums for the few insurers that remain in the state. How do you plan to fix that?
Okay, that's what I thought the question was, but I got totally confused when my two opponents said that this was, quote, solved and stabilized. Because as a person who has to tell people how much their premiums are every year as a small business owner, I can tell you one thing. The insurance in New Jersey is far, far from solved or stabilized. The whole notion that the work is done is just absurd. There's a lot more that we need to do. A lot. And I worked for a period of time in the home health care industry, where I used to watch patients who would bring a son or daughter home from the NICU on oxygen or on a ventilator, who have to listen to an insurance company say, well, even though your doctor wants 24-hour nursing care, our system says you're only entitled to 12. Yeah? The notion that this is in any way solved is ridiculous. There's a lot of work to do, and there are bills right now that can solve this. Again, things we can do tomorrow. We can allow insurance companies to compete across state lines. Let other insurers in New Jersey, let that drive down our premiums. And let's not have to tell a mother or a father with a daughter or a son who's coming home from the NICU that what the doctor says isn't right and what the insurance company is. And I would fully support Tony's bill, along with Assemblyman Bramnick, which will let the doctor make the decision for the health care you deserve and not the insurance provider.
Okay, thank you. Darcey wanted to comment on that.
2 comments. One, I am fascinated to know that my opponents believe that a doctor and a patient should have the direct discussion of the right care for them, because that's exactly the issue that is at stake in women's right to choose, where women should be able to work with their medical care provider to determine when and if they are starting their care. Second, what Senator Bucco outlines is a repeal of the 10 essential health care benefits that could have saved my sister's life. But if you remove those health care benefits, the math doesn't work. People have junk plans, you go to use them, and then you have problems.
That's not at all what I said. What I said is that men should not have, insurance policy should not have to cover procedures that don't apply to men. That's what I said. So let me tell you something. The Beata nurses, I find your comments on healthcare offensive, quite frankly, both of you, because I was last year named the legislative champion for the disabled by Beata nurses for the work that I did in getting coverage for a quadriplegic girl,
Okay, thank you. Thank you.
in home care in Bergen.
Tony, that's enough. Lisa.
Senator Bucco is not telling you that he voted against all of this legislation that Darcey and I are telling you has been good for the state. He voted against the mandate that makes the math work. He voted against the law that enshrined all the benefits of the Affordable Care Act for New Jersey residents. He voted against the reinsurance program. So everything that's making health care better here in New Jersey, he voted against.
One more.
What I voted against was having the state run it versus the federal government run it. Why should the state of New Jersey pay for it when the federal government was going to run it? And that's why I voted against it at that time.
Okay, we're going to take a break from this. We will return.
Morristown.